How are you?
Good, thank you very much. So I want to thank everybody for joining us. I'm very glad you could do it. Thanks for taking the time to hear the talk. I'm very proud to present to you firstly Professor Shai Ashkenazi, who's the Dean of our medical school. Professor Ashkenazi was also a member of the National Council for the Health of the Child, a member of Scientific Advisory Council, and director of the Research Lab for Infectious Diseases at the Millstein Medical Research Center. He was also the chair of Scientific Council, first chair of the Pediatric Infectious Disease Group, and chair of the Oregon Transplant Committee, European Society for Infectious Diseases in Children, and director of the Pediatrics Department A at Schneider Children's Hospital. And he's now the, as I said, the dean of our Dr. Miriam Sheldon G. Adelson Medical School at Ariel University. Professor Ferrer is the deputy dean of the medical school, and is very involved in advanced research in certain kinds of cancers, and also immunology. On that count, because time is short, I am very proud to hand over the floor to Professor Ashkenazi and Ferrer.
Okay, hi everyone. It's really my pleasure to see you all. And I will give a short introduction, but first and most important, each of us and you, we have to take care of ourselves, to obey to what is called social isolation, because right now it's the only way actually to prevent of being infected with this coronavirus. As of today, globally, there are about 1 million cases of coronavirus disease, of whom about 50,000 unfortunately have died, which is about 5% mortality, which is relatively high, 20 to 40 times higher than the influenza that we see each year. In Israel, we have about 6,100 cases, of whom about 30 have died, which is 0.5%, relatively low, one of the lowest rates of mortality worldwide. And as I said, currently we don't have any special treatment or prevention methodology for this virus, and just being careful, taking care of the regular hygiene measures are the way to prevent the disease.
So if I may, just for 1 second, if possible, if people could mute their microphones, unless they have a question while the professor is talking, because some people got some noise in the background. Sorry to disturb.
Thank you, Adrian. And thank you very much for setting this meeting. I think it's very important to be in touch with our friends overseas and talk with them and see the reactions. So I'll be happy to answer questions, but let me maybe first say what actually is done in Israel and at Ariel University Medical School in order to take care of this epidemic. So, you know, in medicine, prevention is always the best. Prevention is better than cure. So in Israel, we are involved in active immunizations against coronavirus and passive immunization. Active immunization to prevent the disease for a long time is being studied now in many places all over the world. What we have in Israel, we have two groups. One is the Migal Research Institute in the Galilee, and actually they are in advance of others because they have already developed an active vaccine against coronavirus of chicken. And now they're trying to modify this vaccine so that it will be effective also for human coronavirus, which is a mutation of this chicken virus. And another approach is done by the Institute of Biologic Research in Israel, and they are working on a subunit vaccine based on the fact that we know that the spike protein of the coronavirus on the envelope of the virus is a very critical virulence trait, and trying to work on it with a subunit vaccine is one of the ways to have the vaccine. Still, this new approach will take a few months. The Migal approach, they have already have in hand the vaccine against chickens, so maybe it will be easier to make the transition from this chicken to the human disease. So this is the active immunization, prevention of the disease. Another more immediate response is what we call passive immunization. In other words, just preventing the severe disease by passive antibodies that we give to the patients to help them for a short time. And with this regard, actually the FDA and the Ministry of Health in Israel have approved already taking sera from patients who recovered from coronavirus, and from their sera isolate immunoglobulin and give it to the most severe patients with a severe disease to prevent mortality. This is a traditional approach that is done when we don't have an active vaccine. Obviously, it's limited. It's from patients who recovered. Another approach, more sophisticated, that we try to pursue at the Ariel University Medical School is have a sophistication of having to study the repertoire of the T-cell response, the cellular immunity against the virus, which is most important. And for that reason, we have already made connections with Corona Hospital in Israel, the Hasharon Hospital, where they have patients with coronavirus. And the Israel Science Foundation, the ISF, have already sent a call for research proposals in terms of the coronavirus. So Professor Führer and myself are trying to write an application based on this innovative approach to understand the cellular immunity to the rotavirus in collaboration with this head of the department of the coronavirus at the Hasharon Hospital. And maybe at this point, I would ask Professor Führer. He is a world-known immunologist and the vice dean for basic studies in the Ariel University. We work together a lot of time, and I appreciate working with him. So maybe I'd ask Michael Führer to talk a bit about this approach of passive immunization.
Okay.
Please,
Thank you, Shai. Can you hear me properly?
Yes, we can hear you clearly.
You speak more loudly.
Okay. So as Shai explained, what we're interested in at this point in time is to understand the immune response of people who have with different subgroups of patients. We're interested in finding out the repertoire of the immune response in patients who have recovered and in people who have been exposed to the virus but were not hospitalized, stronger people. So this is actually very important for two reasons. The first is understanding the antibody response, the serum response, in order to understand which type of antibodies we should be able to use for passive immunization, as Shai explained before. The other part of this is understand the cellular immune response, which takes a little longer to develop, but is much more effective in the long term. And this is what we want to stimulate with the vaccine. So from the long history of vaccinations that we have around the world, it's understood that by understanding better the immune response, the cellular immune response, we'll be able to understand what type of vaccine is needed and how to immunize patients in order to achieve that type of immune response. So we are starting studies with different hospitals to get patients' blood samples, and we will be following this up to understand how these patients have reacted to the virus, whether this is different from the flu virus or other coronaviruses, and to understand how they've responded to this. So in other words, we'll be able to learn how to proceed in the future.
Okay, thank you, Michael. And in terms of treatment, we don't have really specific therapy yet for the coronavirus. Most of the treatment is supportive therapy, oxygen and helping in ventilation and so on. But there is a company in Israel, Gilad company, who is using the trying to develop the medication remdesivir for the coronavirus. It worked pretty good for SARS, and now they try to make the transition from the SARS treatment to the coronavirus. As you know, actually the new coronavirus is a new family in the group of coronaviruses. We have several groups, and the SARS in 2003 and the MERS a few years ago are another group of coronaviruses. So this is in terms of treatment. What I suggest, we have additional things to deliver, but maybe we'll open the phone for questions. And, you know, I did my fellowship in infectious diseases in Houston, Texas from 1987 to 1990. And actually, I'm board certified in infectious diseases, both in the States and in Israel. Yes, please. So any questions, ideas?
Yes, I have a question.
They are for you.
I have a question from Myanmar. We're working with the government here now to deal with this problem before the virus is come with only 5 reported cases in the whole country. Anyway, 53 million people. Anyway, the question I have is, there's a lot of talk about HCQ, hydroxychloroquine, as an antimalarial drug that's having some effect on patients with the COVID-19 virus. And the question is, what information can you share with us about this, and whether this is something that governments ought to be pursuing before we get a viable cure or vaccine?
Yeah, thank you, Mark. That's a really important question. We use it. We know the chloroquine and hydroxychloroquine for a long time. It's a pretty safe medication. And now it is used mainly for malaria. And now we know there is some activity on the coronavirus because it changes the pH of the small particles within the cells in which the coronavirus survive and multiply. So there is some effect. Now we should know, you know, in medicine, whenever you have a new medication, you like to have a double-blind, preferably placebo-controlled studies. You take one arm with few hundreds of thousands of patients, you give them the medication, the other arm get the placebo. Here we don't have that data for the coronavirus because we need to treat the patient. So we have few case reports and small series, one from France, a small group from Israel, one from the States, and there is some promising finding. And what we do in Israel, like in the States, is given what we call a compassionate treatment. If there is a severe case, one who is ventilated, is with the risk groups, he might have a fatal course, so we deliver this medication to him. So that's a thing that we do. And another medication that in small series seems to be helpful is azithromycin, studied by Didier Raoul in France. They have 26 patients with coronavirus. They gave azithromycin and chloroquine, and they saw improvement. Again, it's not a controlled study, but as far as we can say right now, for severe cases, we can use compassionate use of these medications. The FDA actually also has issued a permit, quote unquote, to use this medication in the severe cases.
If I could ask,
Thank you.
The theory that a lot of people are touting that it's maybe better to expose the community to coronavirus so they can build up antibodies and maybe isolate people over the age of 60 who are weaker. What's the debate there, and what's the validity to that kind of theory?
Hi, can I call you back in about 10 minutes? All right, fine.
Yes, please. Okay. So we know that the disease is more severe in older persons. That's clear. The mortality is highest in older persons, and actually children have very limited disease, very mild disease, although in Belgium, there was an adolescent, 14-year adolescent who died, but it's very unusual. We don't understand why. It has probably to do with the receptors for the coronavirus. The receptor is the ACE2 receptor on the epithelial cells on the respiratory tract. And we think that the number of receptors is relatively low in children. We are not sure that's the answer, but that's another thing to investigate. But anyhow, as the disease is more severe in the elderly, it's very important right now to have strict social isolation. You know, it's not easy in the Jewish people not to see the grandchildren, not to kiss them. You know, my grandchildren as well. I see them in the Zoom like I see you guys right now. And it's not easy, but you know, we have to save lives. V'nishmartem v'nafshotechem is very important. And we have to keep this in mind until we'll get over this period. And you know, I'm always asked as an expert in infectious diseases, when will this epidemic will be finished? And the clear answer is, I don't know. No one knows actually. It's a new virus. Human body doesn't know this virus yet. But what we can say from the history, that when we had epidemics, and one have to study history, also history of medicine, and see the implications. So from the history, there are actually, in terms of infectious disease studies, 3 conditions by which an epidemic can be stopped. One is that we have a good vaccine. Like the Asian influenza in 1976, there was a vaccine. In a few months, it was over. Another possibility is that most of the population developed antibodies to the new virus that cause epidemics. And actually, in a way, once more than 80% of the population develop antibodies, you stop the chain of transmission. You cannot transmit the virus effectively. And this happened in the Spanish flu in 1918. It took some time, but over 2 years, actually, 80% developed antibodies and it was stopped. And the third possibility in terms of infectious disease is that the virus causing the epidemics disappear. This happened with the SARS virus in 2003, began actually the end of 2002. In few months, it was a more severe disease with more than 10% mortality rate. Most patients were hospitalized and isolated, as opposed to the current coronavirus. And in few months, there was no virus circulating anymore. So when there is no virus, no causative organism, the epidemic stops. So we'll see what will happen with this epidemic.
If there's any other questions,
it's Harvey Wolf. I have a question. You were talking about the vaccine, and it apparently is working successfully with chickens. Question is, how long will it take to know that the effectiveness, if indeed it happens, is good for humans?
An excellent question. You know, we know that the family of coronaviruses, there is some overlap in terms of genes. For instance, the SARS, which is another coronavirus, has 87% overlap with the genes of the current RNA virus of the coronavirus. And the chickens is about 80% overlap. So we are not sure. Maybe some modification will have to be done. I'm not sure, but you know, it's a bit promising that you have in hand a vaccine against coronavirus or another member of the coronavirus, but it will take some time. That's why for the immediate period, probably the passive immunization will take care until we'll have an active vaccine. That's actually the general approach in medicine. You use the antibodies, T cells may be passive immunization short-term protection until you have active immunization for long-term years of protection. Anyone from New York with our audience, Adrian?
Jeffrey.
Jeffrey.
No, we have a few folks. Let them. You know, I'll defer to them.
Okay. Actually, in fact, my youngest son he did a relocation with a startup company, and he's currently in Riverdale, New York, with his wife and his son. Interesting.
Yeah. I think Sam, even though Sam, you're not in New York, you can certainly speak if you'd like to.
יש מחול. כולם מחול, חלק מחול, אבל אני יוצא בגלל שזה...
So I'd say if there's no more questions, I don't know if perhaps Professor Ashkenazi, Professor Ferrer, would you like to sort of sum up with the point, the final point?
I sent a question on the chat.
Hold on. I've heard various opinions on how long. Okay, so sorry, Amber. Sorry, I missed that. Amber asked, I've heard various opinions on how long testing out a new vaccine should be done. How long do you believe that testing should be done?
Well, you know, a new vaccine which you like to give to millions of people or thousands of people should be examined. And usually there are 3 stages in the examination of the new vaccine. Phase 1 studies, it's really short time and simple. 1 dozen, 2 dozens of vaccines. It is done currently in Seattle, Washington, and it's done also in Israel. Then you look for a phase 2 study where you vaccinate about maybe 100 people and look for the safety and immunogenicity, development of immune response. And the last part is the double-blind study that you have to take few thousands. One arm will get the vaccine, a control arm without the vaccine, and you see what protection you get. All this after doing in animal studies. So it said it will take at least 6 months, 12 months to develop a efficacious and safe new active vaccine. Hopefully till that time we can use the passive immunization.
I have a question from Myanmar. Yeah.
Okay, Mark.
Yeah, my question concerns the use of face masks. There's a lot of confusion about this. We saw recently a video from the Czech Republic suggesting that their low rate of mortality in that country was due to the fact that they required all of their citizens to wear masks at all times. And be effective with respect to people who are symptomatic and prevent the spread of the disease to others. What is your position regarding this issue on the use of face masks?
Yeah, well, there is a controversy, I must say. And I have said my opinion. I was involved in some discussions before getting the Israeli recommendations. So as you said, Mark, it's clear for those who are sick with coronavirus, masks are important to prevent the disease from being transmitted to other persons. It's an airborne transmission. Droplet nuclei from the sick patients transmit the disease to other persons either directly or through contacts on several places and so on. So for the sick people, there is no question. The question if healthy people who has to go outside, let's say for the grocery, you need to go to the grocery, should you use a mask? My idea was that yes, it's not 100% prevention, but it will reduce the possibility of being infected. And my position was yes, and I'm happy it was adopted in Israel right now. We should be sure that it's not 100%. And in addition, one should use the mask appropriately. A wet mask, which is used for many hours, is useless. So We have to use the mask, put them carefully. When you take it out, don't touch the outside the part of the mask. And actually, these are now the recommendations in Israel. And I believe they are appropriate. It was done in Southeast Asia, and actually it stopped the transmission. So I think all medicine, is not yes or no. Even if it gives 50% protection, 80%, it's okay. It's better than zero.
We're running short on time. We have 8 minutes left to what I ordered. There's one last question from Amber. She asked, do you think there's a mistake not to close the takeout and restaurant delivery in New York?
I think takeout is appropriate. People who are at home now with these times, including myself, you have to eat. You cannot starve, yes? So I think it's better than going to the supermarket and being involved with many people. Takeout and delivery to home is much better. So home delivery is probably the best. And actually, in certain areas in Israel, it was done very nicely, including in the city that I live, Petah Tikva. The municipality had a list of the elderly who are at home and maybe don't have anyone who can take care of them, and they send hot meals to this elderly through the municipality. So I think it's a very good approach, but you need to have supplies and to eat, that's of course.
Thank you very much. So Amber wrote, I meant the restaurants only. I think that was answered in Professor Ashkenazi's answer. We're running down in time now. So first, I just want to thank everybody for joining us, take your time out to hear both Professors Ashkenazi and Ferrer. Thank both of you, Professor Ashkenazi, Professor Ferrer, for your time. We have had requests after our earlier meeting today, and from people who were invited to do a few more after Pesach. So we'll be happy to update you about that. And of course, if anybody sends any questions, we'll be happy to pass them on to have them answered. And we just wish everybody a Chag Sameach, and that we should get through this as quickly as possible and move on to more positive things.
Healthy Pesach.
Healthy Pesach, yes.
Yeah.
Thank you all very much.
Thank you.
Stay well, take care of yourselves.
Thank
All
you,
the best.
professors. Very impressive. Thank you.
All the best.
Thank you. Thank you so much.
Very much, guys.
Shabbat shalom.
Shabbat shalom.
Shabbat shalom.